Hi, my name is Kayla Witherspoon. It is November 23rd, 2022. I will be presenting on case studies 2 and 4. So for case number 2, in this case, a teenage girl is asking questions about glycogen storage disease. And so her first question is, I'm not sure I understand the issue. Can you explain how muscle glycogen is generally used during exercise? And so a good response would be during aerobic activity, like walking, jogging, swimming, or cycling, the skeletal muscle takes energy from free fatty acids by oxidizing them in the mitochondria through the beta oxidation pathway to form acetyl-CoA. Acetyl-CoA is metabolized via the Krebs cycle and the respiratory chain, producing adenosine triphosphate, or ATP. In anaerobic activity, such as weightlifting or sprinting, the myophosphorylase, or the glycogen phosphorylase enzyme of the skeletal muscle, breaks down glycogen into glucose, which then enters the glycolytic pathway, producing ATP anaerobically. This is referred to as McArdle disease, resulting from genetic mutations involving the muscle-specific isoform of the glycogen phosphorylase enzyme. This enzyme is critical in the first step of glycogenolysis, which releases glucose 1-phosphate monomers in muscle fibers. The carbohydrate metabolism of the skeletal muscle is affected, and energy cannot be generated from the muscle's glycogen stores. The second question is, I like to take long walks. Will I still be able to do this with my friends? Long walks should be avoided in this condition, sometimes again called McArdle disease. You may experience tiredness and muscle cramps if you participate in strenuous or prolonged activities. Other symptoms include painful muscle cramps, weakness, and fatigue. As a result of this deficiency, will I need to get up at night to eat to maintain my blood glucose levels? The answer is no. Dietitians recommend drinking 37 grams of sucrose 5 minutes before exercise, though, to reduce the initial symptoms of exercise intolerance. A diet rich in carbohydrates results in much better outcomes in comparison to a protein-rich diet in similar patients. And her last question is, do I need to worry about producing excessive lactate during intense or anaerobic exercise? And it is believed that individuals with a deficiency of glycogen phosphorylase do not produce lactate during exercise. Since glycogenolysis is defective, no pyruvate and subsequent lactate are created through the usual pathways. So this is not a concern in glycogen storage disease. And hopefully those are all understandable answers to the questions. So she can maintain a normal life. And so case number 4, in this case study, a 2-month-old baby is experiencing jitteriness, an enlarged liver, and other symptoms, and has only been fed breast milk by their mother. So there were several possibilities to what the disease could be, and I'll go over each of them. But in the various forms of glycogen storage disease, or GSD, the symptoms first appear in babies or young children. Symptoms will vary based on the type of GSD, type 1 through type 4, and the enzyme they are missing. General symptoms are enlarged liver, growth delay, heat intolerance, low blood sugar, easy bruising, swollen belly, muscle weakness. Infants may experience acidosis of the blood or high cholesterol, hyperlipidemia. This is the most appropriate condition based on the symptoms experienced by the infant, especially the enlarged liver and hypoglycemia. So we can assume that the infant is experiencing a glycogen storage disease, and I'll explain why the other answers are incorrect. But first, blood lactate increases after an epinephrine injection. They gave the baby an epinephrine injection. because the baby lacks the enzyme that breaks glycogen down into glucose, leading to accumulation in the liver. This indicates that the infant is suffering from type 1 GSD, or the absence of the enzyme that converts glycogen into glucose. It is also common to see this type emerge in babies 3 to 4 months old. Considering the patient's age, GSD type 1, also known as von Gurk disease, is suspected. Genetic testing is then used to confirm the diagnosis because it is a genetic disorder. And here are some other reasons why the other suspected illnesses were incorrect. Hereditary fructose intolerance was an option, and hereditary fructose intolerance is a metabolic disease caused by the absence of an enzyme called aldolase B due to an autosomal recessive mutation. In people with HFI, ingestion of fructose and sucrose causes severe hypoglycemia and the accumulation of dangerous substances in the liver. HFI may be a relatively mild or very painful disease. The most frequent symptoms are diarrhea, abdominal pain, growth delay, and nausea. And since the baby is only breastfeeding, there's no risk of ingesting fructose or sucrose. It's only receiving breast milk, so there's no way that HFI could be the disease. In galactosemia, the common side effects are loss of appetite, lethargy, vomiting, diarrhea, severe weight loss, weakness, failure to thrive, jaundice, enlarged liver, abdominal swelling with fluid, swelling around the brain or edema, and the baby's not experiencing any of these symptoms, so we can rule it out. And glucose 6-phosphate dehydrogenase deficiency is an X-linked recessive condition in which blood cells are destroyed when the body is exposed to, when it's exposed to certain foods, drugs, infections, or stress. The enzyme glucose 6-phosphate dehydrogenase helps red blood cells function and is absent or reduced in this condition. Symptoms may include dark urine, fatigue, paleness, rapid heart rate, shortness of breath, and jaundice. These symptoms also are not consistent with the infant, so we can rule it out. There's no indication that the baby is having a reduction in red blood cell function. So we can go ahead and assume that the baby is experiencing glycogen storage disease type 1. And that is it for my presentation on cases 2 and 4. Thank you for listening. I really appreciate it. And that is the end. Thank you.